Okay, so welcome everyone. I'm Christy Cahill. I am the Executive Director of the Colorado Cancer Coalition, and I'm so excited to see so many faces here for our first quarterly partner meeting for 2022. There's lots of new faces and lots of faces I recognize, and I'm just so excited that you're here. Today, we're going to kick off 2022 by sharing some new plans we have. We're also going to review some successes from 2021. We'll talk about new regional cancer networks. We'll have some new task force members from the Spanish-speaking task force discuss their preliminary goals and where they're headed. All of our task force chairs will be here today to talk about their action planning and where they're headed. I have just a few general coalition updates. Then there'll be time for you to provide partner updates, as well as time for some networking via Zoom breakout rooms at the end. And I know when people see breakout rooms, they generally like, oh, that's my cue to leave. But this is our only way to network in this pandemic life we're going through. So I would highly encourage you to stick around for the networking so that you can meet new people and find new collaborations. So if everybody could put their name, their organization, and their role in the chat. We have 47 of you here today, and so it would take a little bit too long to do it all coming off mute. So if you could put your name, organization in the chat, and then you can chat with people directly on Zoom. And I'm happy to make any connections after the meeting as well, so that you can keep the conversation going. So I'm going to go over a little bit of highlights from 2021, and this is in no way, shape, or form everything that happened. So I'm just pulling out a few highlights. But before I do that, Becky, will you bring up the first poll, please?
It's saying it is inactive for me, so maybe someone else has controls. Maybe you do this time.
Liz, are you on? You might have controls. Always fun with technology.
It looks like just you and I are the hosts.
Okay, we'll come back to that later and try to figure out who else has poll capability. Or you know what, we can do it in the chat too. My question is, have you seen the new 2021 to 2025 Colorado Cancer Plan? So if you could just go ahead and put in the chat yes or no if you've seen it. Let's see, I'm seeing a combo. Okay, so it looks like a little more than half maybe have seen it. So I'm gonna have, Becky, can you put the link into the cancer plan into the chat? So we just launched the cancer plan last summer. We're on our 5th iteration of the cancer plan, so 25 years of cancer plans in Colorado. And oops, excuse me. Here is a snapshot of the goals in the cancer plan. The cancer plan spans the continuum from prevention all the way through survivorship and end of life care. So goal 1 focuses on tobacco use and decreasing tobacco use. Goal 2 focuses on increased prevalence of healthy behaviors. Goal 3 it focuses on uptake of clinical interventions to prevent cancer. So that's looking at family history and HPV vaccine. Goal 4 is decreased environmental exposures that lead to cancer. So looking at radon and other environmental exposures. Goal 5 looks at cancer screening and trying to find cancer earlier. Goal 6 is on consistent access to quality diagnostic and treatment services. So really focusing on the treatment side of cancer. And 7 focuses on clinical trials and trying to get more patients into clinical trials and diversify the patients that are enrolling in clinical trials. Goal 8 is all about cancer survivors. And goal 9 is about navigation and patient engagement and health literacy. So I highly encourage you to check out the cancer plan, and it has ideas for strategies on how you can help improve cancer outcomes in Colorado. There, for each goal, there's multiple objectives as well as multiple strategies, and they just give you really good ideas for how to do evidence-based interventions to really improve outcomes here in Colorado. The other success I wanted to share is that we launched our Cancer Coalition in Communities campaign, and we piloted this in Cheyenne County, which is about as far east in Colorado as you can go before you get to Kansas. And we did a lot of listening to what their needs were from the hospital, from public health, from the community. And then we tried, along with our task forces, to figure out what education could we provide, what services could we provide. And we did a lot of different activities. We took the Sun Bus out there and did some skin cancer checks. We did a lot of education around, they do a big fair in July, and so they had a very high traffic event. And so along with the skin checks, we were providing other information on knowing your family history, knowing what cancer screenings you were due for, and trying to get connected to the hospital so you could get in for those cancer screenings. And now we're looking at some of the survivorship and how we can help with their survivorship support groups. And then also just overall awareness and education through their public health department around the HPV vaccine, other cancer screenings, other cancer resources that we can bring out into the community. And so we're hoping to take what we've learned from this one pilot and then pick different communities in rural and frontier areas and do similar things out in those communities. And if you have a question as we're going along, feel free to use the raise hand function. You can get to that through the reactions and raise your hand, and then we can call on you. I also wanted to share this. This is a great example of coalition work at its finest. So with the University of Colorado Cancer Center, the Office of Community Outreach and Engagement, we created this map so that you could visually find resources that are close to you. So we had previously had a version that was themed by, and it just had icons. So you had to know, you had to click on the icon for what you were looking for and then see if there was anything remotely close to you. But this way you can scroll on the left-hand side to different topics and visually see on the map if these resources are close to you. And how this came together, we shared the data that we have for our resource directory so that they could put it on the map, and then we're both helping update it and keep it up to date and add new resources as we find it. So thank you again to the Office of Community Outreach and Engagement for making this map come to life. But it's just a great example of leveraging resources when we don't all have really large budgets to make things like this happen. So Becky put the link to that in the chat. And then we also have it available in Spanish as well. So let's see. And then here's another one. We did 2 different social media campaigns last year, really just to elevate the conversation in Colorado. We did one around World Cancer Day, where we shared 25 stories of different coalition members and different coalition supporters on who they are and what they were doing in the fight against cancer. And this one right here, he's a representative from a rural town in Colorado. So we're glad to have it. He's been really supportive of our colorectal cancer policy initiatives. The other campaign we did was around Healthcare Decisions Day. And we had about 16 people share their story of why they put together their healthcare decisions and advanced directives And we shared resources around putting those together as well. So we'll be doing these campaigns again. You should be getting our emails to see how you can engage with those, but we're really hoping it'll go viral this year and really elevate the cancer conversation in Colorado. I'm going to go back. So these are just a sampling. My task forces did great work. Some of it that they'll talk about in the once we get later on in the meeting. But we finished an employer toolkit for colorectal cancer screening to try to get employers to give their employees time off to go get cancer screenings. We held the lung cancer symposium again and had a lot of great attendance at the lung cancer symposium. The task force has also hosted a lot of different educational webinars to reach oncology audiences. And so it was a great, everybody's figuring out how to innovate and navigate this pandemic. And I think we had a lot of great content. Over 750 people engaged with the coalition in some way last year, either through task force work or webinars and symposia. So thank you to everyone that helped participate last year. And I'm glad to see some new faces this year to grow that number. Maybe we can reach 1,000 people this year in 2022. Okay, we likely cannot do the poll question. So we'll just skip that. So now we're going to move on to where we're focusing in 2022. So Sarah, are you on? Yes.
Yep,
Sarah, actually, you'll be up very shortly.
Yeah, no worries.
I jumped the gun. So for 2022, we'll be looking at regional outreach approaches to really reach the rural and frontier communities. And Sarah's going to talk a little bit more about that. We also have a new Spanish speaking task force. And so you'll get to meet them today and hear what they plan to work on. The task forces are all in the process of action planning. So hopefully if you're engaged in that task force work, you have seen those emails about action planning. And then we're also looking at restructuring and expanding the coalition steering committee to just further improve the work that we're doing. So now I'm going to call up Sarah to talk about the regional cancer networks.
Awesome. So hi, everybody. I introduced myself in the chat, but I'm Sarah Roberts. I work with the University of Colorado Cancer Center. I'm specifically in the Office of Community Outreach and Engagement. And we are doing we just were awarded a supplement. And when we say supplement, we mean it's supplementary to the parent grant or the larger body of funds that the National Cancer Institute provides for the University of Colorado Cancer Center, because we're the only NCI designated cancer center within the state of Colorado. So sort of a long explanation there, but basically it's a supplement. It's a grant provided to us, awarded to us by the National Cancer Institute. And it's a partnership to implement evidence-based interventions so that we can try to reduce the cancer burden. Right now we are, go ahead.
I'll just slow down just a little bit.
Oh yeah, sorry. Sorry. This is my first time doing a interpreted Zoom call. So thank you for that reminder, Christy. So the NCI supplement is a collaboration between the University of Colorado Cancer Center, the Colorado Cancer Coalition, and CDPHE. So the Colorado Cancer Coalition, as you all know, of course, being on this call, we are able to address much of the larger state, but we're trying to implement regional infrastructure and sustainable infrastructure across Colorado so that we can have focused goals and efforts to reduce the cancer burden. So I have a couple more slides here after this, but we want you guys to join in if you live in any of the regions that we'll talk about, so that you can help us also recruit new organizations to each regional network. You can go to the next slide. So this is just a graphic of what the proposed regions look like. It's fluid and it's definitely a work in progress. So these are not by any means set in stone. We just were awarded this supplement, so we're still finalizing what each of these regions will look like. But as you can see on the left side, the yellow region is the western part of the state. So we're going to be dividing that up into 2 different regions, both north and south. And then the light blue area is the San Luis Valley region, down near this lower central part of the state. The red region is the eastern part of the state. And again, we are determining where and how to divide that up. Right now, we have it divided into north and south. And then the green region in the map is the Central Mountain region. And then the purple area
Hey,
there.
Alexa?
Go ahead.
She is, but she's on the other line. I wonder if
Oh,
you
I think
can
someone's
stay
just
on
got
to it.
muted.
This is Peg Ellison. I'm a realtor and I'm working with Corey Green on the purchase.
Okay, we should be good now.
Okay, I was gonna say, I didn't know if that was a question for me, if I was missing something. Thank you. So this is essentially just a visual of what the regions look like. We're funded by the National Cancer Institute, and this is a joint collaboration between the 3 organizations that you see listed there. You can go ahead and go to the next slide, please. So project overview, we've got 2 aims. Our first aim is, of course, to convene these regional cancer networks. We want to try to provide more focused approaches to building infrastructure to implement evidence-based interventions. And we want to, each region will be able to set priorities and set an action plan, which also aligns with the Colorado Cancer Plan. And when we talk about evidence-based interventions, that goes into our second aim. We as a supplement team will help facilitate projects to study what the implementation of these evidence-based interventions can look like to address the regional cancer priorities. So a lot of times when we talk about cancer prevention and control, it's more at the state level. And we're hoping that developing these regional cancer networks will arm each of these communities to provide their own plan that is more relevant specifically to their community needs. So we'll be able to partner the regional cancer networks specifically with investigators to conduct different pilot projects on evidence-based interventions that align with the community needs and also the Colorado Cancer Plan. You can go to the next slide. So our ask again is to, number 1, help us spread the word. These regional cancer networks, it's a 1-year-long supplement, but these regional cancer networks are going to be a long-term approach. We're going to kind of feed them into the work that the coalition's doing. So these regional cancer networks will also be involved with the partner meetings that we're doing right now, and so on and so forth. They'll be able to connect with the task forces. If you have any recommendations for who would be good to reach out to, specifically maybe to help lead the regions or just to be involved in the action planning for each region, you're welcome to email myself. There's my email, but you could also email Christy if that's an easier email for you to remember. And I see a question from Janice. The project, we're really in the early stages. We're trying to narrow down who the regional cancer networks leads are, but the project is funded through 2022. So I guess it starts whenever we are able to convene each of the region leads, and then it's through the year.
And I'm looking at sustainable funding for the regional cancer network leads going forward so that we can keep the momentum going. And my hope, when the world can go back to normal, to whatever that new normal looks like, is that these regional cancer networks are set up so that when we host meetings, these partner meetings, they can have their own in-person, if we're having ours in person plus Zoom, they can have their own in-person portion where they can do physical networking amongst their region and benefit from that there. And so that's the long-term goal when we can go back to in-person and when we get these off the ground. Are there other questions? I'll just pause right now. Are there other questions about these regional cancer networks? Okay, I'm not seeing any. And I think we got the polls working. So Becky, do you want to pop up the second poll, please? Is it popped up? I can't see.
Yes.
Okay, all right.
Yep, it popped up for me.
I'll go ahead and end it because look at you all. 100% participation. Oh no, 70% participation. We can get that a little better. I'll leave it up for another 15 seconds. All right, I'll go ahead and close it out.
Can you just go ahead and read it out, Becky, since I can't see it?
So we've got 59% said yes, they've attended a meeting before, and 41% said no, this is their first one.
Awesome. Well, glad to again to see familiar faces and glad to see a lot of new faces. So thank you all for being here today. Okay, well, we'll move on then, and I will call up Virginia to talk about the Spanish-speaking task force and introduce this new group.
Okay, thank you, Christy, so much. And it's a pleasure being here with all of you guys. It's our first time, and this is my personal first time being here with this amazing coalition. And I just want to say thank you on behalf of all the folks and the guys that I represent at the Spanish-speaking task force. We truly believe in diversifying the access to the wonderful resources you've been compiling over the years, guys, with the wonderful job you've been doing together. We really believe in increasing the democracy of these resources and the participation of those Spanish-speaking patients, their families, and their co-survivors. We believe that as these 6 women that we are really coming together from diverse branches, positions in our companies and the entities we represent, in the organizations we work for. And we're coming to the table with different points of view, precisely to facilitate the development of these ideas that we have in our minds, to create new opportunities, to collaborate with all of you, to answer some questions that our diverse Latinx communities may have locally and regionally, and to solve the existing problem of what we believe is still, unfortunately, an unequal access to cancer resources within the diverse Latina communities in Colorado. I hope I'm doing a good job when it comes to the speed of my messaging. And after expressing to you who we are, we want to tell you that we're being aware of the circumstances these Latinos face. But more than that, we would like to be attuned of those needs. We believe that you guys are doing a phenomenal job. I cannot say that quite enough, but we still believe that there's always something else that we can do to keep getting better and better at that situation. Next slide, please. The opportunity statement that we chose for this Spanish-speaking task force is that cancer is the leading cause of death among Hispanics or Latinx in the US, as most of you know. And through more public education, community resources, and access to that care, the survival rates will be improving. And that's our hope as well. We believe in diversity, we believe in more inclusion, and that's what we're going to be aiming for. Next slide, please. With the Spanish-speaking task force, we were told by Christy, who been tremendously helpful at telling us what we should do, how we should embrace those opportunities. She recommended for us to have 2 goals in mind, perhaps 3 at most to begin with. So we decided to follow your lead on that one, Christy, and we established 2 goals. The first one being to educate and inform the Latinx community about preventive and available cancer screenings, highlighting the importance of prevention and accessing those services for the Latino community, identifying culturally competent places to receive those screenings whenever that's possible. The second goal is going to be to centralize all that access to cancer resources that include the prevention, the treatment, the local support, and the recovery. These resources shall be culturally and linguistically competent. And I want to make sure that we understand that for us, it's important to really include those individuals, those folks who might be without a legal status in the country. We believe that universal healthcare should be something that everybody should embrace, regardless of your legal status. Because most of these folks, you know, when Patty, when Emily, when Cecilia, when all of my peers in the task force talked to them, when they navigated resources for them, when they got the opportunity to establish a conversation with them, they're going to tell you, you know what, we want to pay for these resources. We want to pay for this treatment. We want to be diagnosed with someone who knows, and we don't mind paying. But in so many occasions, we find out that we're being excluded simply because we don't have a green card status. And we want to make sure that we are covering those folks as well. The idea is also to increase an easy or easier navigation in Spanish for all those families and individuals accessing those resources. With the next slide, we can see our third goal, and we have a fourth in mind, but we're going to just strictly adjust to three. The third being that we want to establish Spanish-speaking support groups where geographically, culturally, linguistically, and socially needed. And here is where I have an ask for you. How dare I, right? I'm just a rookie, and I'm already asking for your help, but bear with me, toy with my idea. Just like Sarah Roberts did before, I would like to kindly ask for your existing connections in place, and perhaps you have someone who can help us to start spreading these goals and these objectives that we have put in mind for us for our first year. Thank you, Valentina, for the reminder. And with our next slide, I'd like to let you know as well who we are in this new Spanish-speaking task force. I would like to highlight first and foremost Patricia Granados, who is the pioneer and a participant of different Spanish supporting groups, survivor of support groups as well in Colorado. And she is very timid, very humble about the opportunity to participate in here. But we all believed that she should be one of our main sources, one of our main powers of support, and really pulling forward this team to really access these patients, these families, these survivors, these co-survivors, because she really has seen firsthand with her expertise what it takes to make a substantial difference when you have the right support in your language, in your culturally relevant environment, and everything else. Cecilia Velarde Thompson is as well our outreach liaison who works for the Penrose Cancer Center. Unfortunately, she couldn't be with us this afternoon, but she's also a pivotal part of this task force. Priscila Cabral, who is the Senior Regional Media Advocacy Manager, is also part of our force, and she works for the American Cancer Society. Emily Zurrico is the independent consultant who is truly the glue that is keeping us together. She's the one who has the know-how when it comes to public health, and she's really terrific at bringing all these ideas together when it comes to collaborations with you guys, with all the organizations that you all represent, with Christy, of course, and with the constituents we're aiming to assist. Patty Galeto is the one who came with the idea. She was the one who reached to each one of us, and who the one who truly consolidated the efforts and the views and the perspectives and the know-how of each one of us, and said, why don't we start that? Why don't we do something for our Latinx? Why don't we stop just saying, why don't they do this and that? Why don't we start embracing that responsibility? So thank you, Patty, so much for being the one who brought us together. Patty Galeto works for the Latino Research and Policy Center. She's a community project coordinator and Latino Health Certificate Administrator. And last but not least, I'm Virginia, and I'm the member of the CDPHE's Breast and Cervical Advisory Board. It's been a pleasure working all this time with Emily, who I've seen in the panel today. And I'm a breast cancer survivor myself, and my sister was a survivor of leukemia. So I know in the flesh what it is to be a survivor of cancer and what it is being a co-survivor myself. So this is our very brief and concise introduction to the Spanish speaking task force. We are hoping to honor all of you with your hard work. We're hoping to be a good member of your coalition efforts, and we're hoping to really bring more to the table for all the things you've been doing so far. I don't know if any of my peers would like to say something. I don't know if Patti Galeto would like to say something in Spanish, or Emily, if you're still available. I know she had some other errands that she needed to run simultaneously, but if any of you like to say something else, this is the time. Otherwise, this should summarize our presentation, Chrissy. Thank you.
Virginia, and the group that's here today, this is Emily. I did want to just add one thing. Thank you for that concise. It doesn't really represent all the work that has gone into that. It's hard to do that in a quick summary. However, I will just put it out there. If you're interested in this cause and this group, please reach out. I'm going to go ahead and volunteer myself. I will put my email in the chat and I can help kind of coordinate that with the group. Because, you know, it's 6 members right now, but we are hoping to grow, and we want to hear from you all that are in the community working there or in organizations. So I'll just go ahead and add that information in there. And Virginia, thank you so much for being our fearless leader today and rerepresenting.
Yeah, and I get very nervous when I have to speak in English. So thank you for the patience with me, guys. And thank you for the question that Tony Abby has spotted there in the chat. She's asking if the Spanish-speaking cancer support groups are going to be offered virtually. That's our hope. We are just 6 gals in this task group. We're hoping that we can grow in the future with some more volunteers, perhaps, or some other resources. And hopefully we can host some of those groups virtually. Yes, Cecilia has been doing some of those support groups virtually, and we hope to increase the number in the near future.
Thank you all so much for being willing to come into the Colorado Cancer Coalition and join our efforts. We are all super excited to see where this is going and see how we can grow this work. I know a lot of our task forces and their action planning, I've been mentioning this new task force in terms of, you know, resources and support that are out there. So as they're, like the lung cancer task force, as they're figuring out their action plan, having conversations with you to figure out, you know, what resources are either out there in Spanish for lung cancer or need to be translated into Spanish. So I think there will be a lot of synergies between all the different task forces and lots of good resources and collaborations to come from doing this work together. Okay. All right, Becky, time for the next poll question, please. And actually, hold on, let me go back one step. Does anybody have any other questions for this new task force or the regional cancer networks? Okay, all right, Becky, let's pull up the next poll question, please.
And so this is poll 3 and 4. Is that right?
Yes.
Okay, it should be launched. We are close to 60%. I'll leave it up just a little bit longer. All right, I will go ahead and end it. So we have about 55% have participated in a task force before, and 53% currently participate in a task force. So we've got, and 3%, oh, that's the Spanish answer. So we've got quite a few folks here who are not in a task force currently.
All right, thank you for reading that out. Okay, so hopefully the next part will encourage you to join a task force if you aren't already on one. I like Carlin's comment. You're cordially invited to the Survivorship and Palliative Care Task Force meeting. That's today at 2:45. So we have 8 different task forces now, and so we're going to get updates from the task forces. And hopefully you'll see a place for you to come and collaborate and make connections. So I'm going to turn it over though to Allie Bain. Allie is the Colorado Cancer Coalition chair right now, and I'll turn it over to her to facilitate the task force update section.
Thanks, Christy. Excuse me. Welcome, everybody. It's very exciting to see all the new faces, and I will just echo what Christy just said, that hopefully you can see how you can fit into some of the work that the coalition is doing through the task forces, either personally or professionally. So I don't know who's running the slides. Becky, are you running the slides? Can we go to the next one? Christy?
Yeah, I am. Yep, I can do that.
All right, so one of our newest task forces is our Clinical Trials and Treatment Task Force. So if you want to go to the next slide, and I saw Reese on. Reese, are you giving an update from this group?
Yeah, I'm happy to. Thank you, Allie. So we are a relatively new task force. So we actually just had our very first strategic planning meeting scheduled for yesterday. And we are currently identifying our priorities and tasks for goal 6, which is consistent access to quality diagnostic and treatment services adherent with nationally recognized standards. So as we speak, we're kind of getting a sense of the landscape and understanding what tools and resources and current projects everyone that's part of our task force are working on. And from there, Lisa Switzer and I will be convening a second meeting to really diving into those priorities. And then we will also be holding a second strategic planning meeting in February to identify our priority for a second goal, which is increased participation in high quality clinical trials. And we are also exploring a rural health working group as part of our clinical trials and treatment task force. So if you are interested in joining us, we are still just getting started, and we would welcome anyone and everyone from all cancer types. And you can email us at treatment@coloradocancercoalition.org. So we're looking forward to an exciting year and really getting this up and running. That's all I got, Allie.
Oh, Allie, I see you're talking, but you're muted. Sorry.
Thanks, Sarah. Thanks, Reese. I was just going to add to Christy's reminder in the chat to make sure that you speak conversationally so that we can make sure that we get that translated. I know that Reese was just really excited.
I was so excited.
All right, next up is the colorectal cancer task force. So Sarah, it's all yours.
All right, thank you, Allie. So I'm the co-chair of the Colorectal Cancer Task Force with Ian Kahn. I don't think Ian is able to join us today, so I'm representing the Colorectal Cancer Task Force today. We're currently undergoing our action planning process, and we're working on discussing where we can improve based on the last couple of years and what areas that we're doing well in. We sent out a survey to our task force where we compared the top most important 3 strategies with then what the group feels like are the top most 3 feasible strategies. And right now we're talking about 2 different work groups, or identified 2 different goals. One of which is reducing barriers to screening, which is the strategy is cited there. And then the second goal is awareness or promotion of screening. So it's been exciting, and it's been a really good process to start the strategic planning with our group. Our task force is also coordinating some food access webinars. In the past, in 2021, we held a food access webinar that focused on the urban setting, and coming up here in a few weeks, somehow it's already February soon, we're going to be hosting another food access webinar in conjunction with the Survivorship and Palliative Care Task Force. So that is going to be on February 16th at noon, and a flyer and registration link will be sent out shortly. So we have 3 current work groups that are kind of either wrapping up what we've been working on, or are still working on what we set out to do. One of which is the provider support work group. What we've done so far is we've interviewed clinics who have previously been engaged with the Colorado Cancer Screening Program, and we're working on offering technical assistance to Summit Clinic for implementing a mail system for returning fit kits to hopefully support their screening rates there. You can go to the next slide. And our second work group is the employer engagement work group. They finished an awesome employer toolkit, which is available for using during a meeting with employers. It's not meant to be just distributed because there's a lot of information that needs to be discussed, but it's an awesome tool that can help employers create cancer screening friendly workplaces. You can go to next slide, please. And then this third one is the awareness work group. So last year, and we're going to set it up as well for this year, the task force set up a Spanish radio interview. So talking about the importance of screening and what different options people have for screening. I think a lot of times people focus just on colonoscopies when they think of colorectal cancer screening. So we're trying to kind of provide more information to the community, especially the Spanish speaking community. We're also helping out with social media toolkits and social media awareness, and then a success story. And if we have time, we can show this video, but there's a pro bono screening day that was held in 2021 in Fort Collins, which was an awesome collaboration. And it helped us understand what the cost of a donated colonoscopy looks like. And it was, yeah, they were able to provide 10, I believe, that day. Do we have time to show the video, Christy?
I think we'll send it out after. I
Okay.
don't put it out with the minutes because there's
Yeah.
a lot of other videos on our YouTube channel too. So I'd like to highlight them all and send those out.
Perfect. Yeah, that's great. Yeah, anyway, this is an awesome video. I hope you guys get a chance to check it out later when that gets sent out. And it's just kind of a highlight of the work that was done for the pro bono screening day.
Awesome. Thanks, Sarah.
Yep.
And I think that the HPV task force update will come from Christy.
Yeah, I don't think Jenny was able to be on today. So they are in the process of action planning as well and figuring out what direction that they're going in. But they did send around some webinars of interest. And so there's one happening tomorrow, put on by the National Native Network with the Indian Health Services Clinical Support Center. So that's highlighted here. And I'll be sending these slides out, and these links are hyperlinked in the slides so that you can access those. But if you are interested in joining the HPV task force, it's just hpv@coloradocancercoalition.org.
All right, thanks, Christy. And on to the lung cancer task force. So I think Dr. Debbie Dyer will be giving us this update.
Yes, hello. And I apologize, Morgan Shan, one of our other co-chairs, and I are kind of tag teaming. So I joined a little bit late and she's had to go off to another meeting. But I am happy to share with you what our task force has been working on and what we're looking forward to in our strategic planning. And if we can just go to the next slide. So one of the things that we have been doing the past, 2 or 3 years is an interrogation of the outpayer claims database so that we know where lung cancer screening is being performed in our state. And we do know that rural areas and some of the underserved areas in metropolitan communities do not have the same access to lung cancer screening. So we're looking at our major goal being in a public awareness campaign, but geared towards more rural communities and areas that are underserved. We would like to perhaps target 1 or 2 areas, and it would be great if we could work with the network cancer access hospitals, the areas that have been designated. We also know that besides educating patients, we have to continue to try to educate providers. And in the past couple of years, we've done lung cancer screening symposia, and they've been virtual. We'd hope to attract primary care providers to those, and we had limited success. So we're now under the approaching the idea of going to them. And particularly in these rural communities, if we could work within a designated system and share with the local providers there what we can about trying to encourage lung cancer screening and recognizing that there is some required infrastructure, but we think we have the right ideas and places have the right tools that we think we can successfully do this. So we're hoping to, like I said, target 1 or 2 areas. The other interesting thing that we're also hoping to do is collaborate more with the CDPHE tobacco control folks and look at how we might be able to collaborate. And, you know, we have pretty much similar goals. And one of the best things you can do to decrease your risk of lung cancer is to stop smoking. And so we think there's an opportunity there. Our lung cancer task force meets once a month. It's the 3rd Tuesday of the month at 5:30 p.m. and it's virtual now. And we'd love to have anybody who's interested join our task force. And we'd especially like to engage some folks from the Spanish-speaking task force, because we know that to reach some of those rural communities, we're going to need to coordinate with you all. So, any questions?
Thanks, Debbie.
Thank you.
Another new task force that we are just kind of ramping up is our navigation task force. So I think I saw Emily on. Emily, are you going to be sharing an update?
Yeah, unfortunately, we don't have a huge update. We just had our first planning meeting on Friday. So we are still in the very early phases. But we are definitely looking for new members. So please, if you are interested in joining the Patient Navigation Task Force, please email us at navigation@coloradocancercoalition.org. We also, I will share that we talked a lot about how navigation can partner with the other task forces in order to help them achieve some of their goals, as well as working on our own. So a lot more to come from the navigation task force.
Thanks, Emily. I love seeing all this like cross task force collaboration that's happening. That's really exciting. Next, we have skin cancer. Christy, are you in this update too?
Yeah. So the Skin Cancer Task Force meets the 2nd Tuesday from 2 to 3 or 2 to 2:30. And so if you're interested in joining the Skin Cancer Task Force, it's skin@coloradocancercoalition.org.
All right, and next we have the task force that's already been putting some commercials in the chat. So I'll turn it over to Carlin and Janice to share about the Survivorship and Palliative Care Task Force.
Good morning, this is Carlin. Janice and I co-chair this task force that's about 180 members strong. And we are very proud of the educational efforts that we try to provide. We have had some amazing speakers every other month. We meet on the odd months and they're recorded. So if you're unable to attend today's meeting or future meetings, please look for them on the coalition website. We believe in working together with other task forces. I'm trying to speak slowly. We did a very well attended medical aid and dying webinar. We had a health disparities webinar, and it really stretched our thinking. We are grateful for the colorectal task force, and we will be working together on the 16th of February for the food access rural version. So please join us for that webinar. Next slide, please. So again, feel free to join us this afternoon at 2:45. We will likely be changing our meeting time to try to reach more people. So come and get involved or send us an email. Know that we are working with our action plan to address mental health and palliative care. So our next work group will be Wednesday, February 9th at noon. And there is a Zoom link that is available for that. So again, feel free to email us. And if you're interested in any possible way to participate, get involved, meet motivated, like-minded people, learn from each other, network, we encourage you to reach out to us and get involved. Thank you.
Great. Thank you all for providing all those updates. And I'll say too that most of the task forces also send out at least a monthly email with different webinar opportunities and other ways to engage. So there's lots of different ways you can engage in a task force. You don't necessarily have to come to all the meetings, although we hope that you will find value in the meetings and come to the meetings to network and share best practices. But if you're interested in a topic, you can get on the newsletter on their list and stay engaged that way as well. I just wanted to mention that, yeah, some of the newer task force opportunities, we will be scheduling soon a breast cancer roundtable conversation. We haven't had a breast cancer task force for maybe the past 4 years or so. So we're going to be hosting that roundtable to figure out what the need is and what direction, if we want to create a task force or just meet quarterly, or figure out what the needs are in the breast cancer community. And then the links, the email addresses were put in earlier for the Spanish speaking task force. So you can also email me. I love having conversations with people that are new to the coalition to figure out what their interests are and then help them get connected to the right task force or the right work group. So I'm happy to set up those phone calls with you. If you have questions about where the right place is for you, please reach out. It's, I'll have Becky put it in here. It's Christy@coloradocancercoalition.org. Before I move on, are there any questions for any of the task forces before we move on to the next piece? And hopefully next time we bring up that poll question of if you're engaged in a task force, hopefully it's 100% yes.
Hi, Christy. This is Janice. I just wanted to add that it is very exciting to have these new task forces as part of the coalition, and the eagerness to connect and collaborate across all of them. So from the Survivorship Task Force, I think it's exciting, especially to have the Spanish group with us so that we can reach these folks more effectively. So mental health is an important part, as Carlin said, for the survivorship goal at this time in our work group. And we strongly welcome and encourage you to join us to help reach our Latinx partners. Thank you.
Great, thank you.
And Christy, just one other thing that I'll add. If you aren't a part of a task force, I would say don't be intimidated to check some of them out. That, you know, there's no initial commitment, just to hear what they're working on, see how their meetings work, share updates from your organization or personally that might be helpful to the task force members. So feel free, half of you on the call that aren't a part of a task force, if there's one you just want to kind of explore, please feel free to do that. So it's kind of a no risk, check things out opportunity. So I just wanted to add that, Christy.
Great, thank you. Okay, now just a little bit of coalition business, and then we will get to partner updates and then the networking piece. So it is tax season, and the Colorado Cancer Coalition is lucky to benefit from voluntary contributions when Coloradans file their state taxes. So when you file your state taxes, there's a form called the voluntary contributions where you can pick, there's 15 different organizations listed, or you can write in your own nonprofit. And we're actually listed as the Colorado Cancer Fund on line 12, and that money comes to us. To then how we use it is to help implement the Colorado Cancer Plan strategies. So it has gone towards HPV vaccination education. It's gone toward motivational interviewing training. It's gone towards exercise for cancer survivors in Alamosa, sites and insights, support groups. It's gone to a variety of sources. And so this year, the funds will be helping, they'll go back to the task forces to help them implement their action plans and really give them resources they've not had in prior years. Normally, I am just like, you have $0, go figure out how to implement your action plan. And so now they'll each have a budget so that they can choose an evidence-based intervention and really hopefully make some strides that way. So if you're filing your taxes and you're getting a refund, please consider a donation on line 12, and please spread the word about the Colorado Cancer Fund, because this really helps us, it gives us that pot of money to really help implement the cancer plan. Then just some other general updates. There are some different volunteer opportunities for the coalition. It's time to vote or to send in nominations for the coalition vice chair. So our structure, we have a chair, a vice chair, and the past chair. So it's a 3-year commitment. We're looking at maybe restructuring this, but for right now it's a 3-year commitment, but it's a really great way. It's a great leadership position and a great way to help guide the direction of the coalition. So if you're interested in a leadership role, I'm happy to send the roles and responsibilities to you. And then we're also wanting to expand the steering committee. We look at who's at the table. We have a matrix, and if we're missing some important voices or voices that represent important contingencies of the state, we try to bring those in. So we're looking for primary care, rural and frontier, a diversity, equity, and inclusion expert, and other representatives from BIPOC community organizations. So if you're interested in that opportunity is also available. And then, as Ali was saying, you can really join any task force. And I didn't want to create a new slide, but I did want to share, we had been working on a colorectal cancer piece of legislation, this legislative session, to cover the cost of colonoscopies after a positive stool-based test. And now from some federal guidance to follow USPSTF guidelines, we actually don't have to run that piece of legislation. Now insurers are just going to have to actually cover that follow-up colonoscopy. So we're in process of still having conversations with the Department of Insurance, as well as insurers, to make sure that they are interpreting this guidance correctly and really planning to follow it so that we don't have to run this legislation. But that's good news that this is coming down at the federal level and might take the lift off of us at a state level to actually run that legislation. If you want more on that, we can connect. I can connect you with the Colorectal Cancer Task Force too. I don't know if Sarah or Ali has anything else to add on that. Or Ali, do you have anything? Okay. Any questions on either the Cancer Fund or any of the volunteer opportunities with the coalition? All right. I guess I had one more update. We have been helping promote the Cancer Support Community's Cancer Experience Registry. And so this is for patients and caregivers to fill in their cancer experience and help inform what the needs are specifically in Colorado around a diagnosis and around being a caregiver and everything survivorship. And so if you can share this with patients and caregivers, it will help inform a report that the cancer support community will put out, which will then just give us even more information as we're doing future action planning on what the needs are in Colorado. And then a lot of these have been mentioned, but World Cancer Day is coming up on February 4th. And again, we're hoping this goes viral. And so we have a form where you can submit your story and we can share it out. Or on that day, on February 4th, you can also just share your own story of how you're preventing cancer on a daily basis. Are you wearing sunscreen every day? Are you going out for a walk? Are you going to a workout class? Are you eating healthy foods? Are you scheduling your mammogram and your lung cancer screening if you're eligible for it? So we're hoping to collect as many stories as we can and just have people organically share their Prevent Cancer Colorado story on that day. Again, there's all the different task forces. Each task force you can join directly, but if you want to have a conversation about how to get involved, I'm more than happy to have that conversation and get you to the right place. And then we've mentioned this food access webinar. We also do a monthly peer sharing session. We just did cervical cancer and the HPV vaccine in January. And in March, we'll do colorectal. The topic varies every month. Sometimes it's a cancer specific topic and sometimes it's more broad. We've done motivational interviewing, self-care, lung cancer and decreasing stigma. So keep an eye on that peer sharing. We love creating a space where you all can share your best practices and network with each other. And so that peer sharing is great for that. And then in April 26th and July 26th, we'll have this meeting again. So we'll have our spring cancer partner meeting and the summer meeting where we'll do task force updates again. And then in April, we'll share some data and a year in review, and we're still fleshing out those agendas. But if there's a specific topic that you're interested in, please don't hesitate to email me and we can see how we can fit that into a cancer partner meeting. So now I want to turn it over to you all to provide your updates from your organizations. If you have new programs, an event coming up, a new article that you helped write, really any updates that you want to share with the broader coalition. And I'll just remind you to, which I need to remember right now, to speak at a conversational, slower speed. But let's go ahead and come off mute, or if you want to raise your hand, we can then call you out either way. But now it's your turn. I know people have great work going on, so let's hear about it. Okay.
Christy?
Jeanette, why don't you go, and then Jamie.
Hi, sorry I'm not on camera today, but I wanted to share with everyone, I'm from Lutheran Medical Center, and I wanted to share that our oncology service line is moving. Some of you may be aware we already moved over to Red Rocks Medical Center campus for our radiation oncology, but we are moving our entire cancer service line effective March 1st. So those support groups have moved effective 2022. So our support groups will be in the Red Rocks Medical Center at our radiation oncology. So I'll put that address in the chat. But we're really excited. It's a beautiful space. So we'll be close to a lot of the surgeons we work closely with. And it looks like we're going to partner with the Red Rocks Medical Center Cancer Survivors Day. And so our plan is to hold a very big co-branded Survivors Day this year there up at Red Rocks. So more to come on that.
Thank you. Sorry, my mouse is super finicky, and anytime I touch it, it likes to advance slides. So I apologize for that. But thank you. That sounds exciting, new things in the works. Jamie.
Yeah, I just wanted to kind of recognize the fact that the American Cancer Society recently published their data on cancer expectations in 2022, and a report on the most recent epidemiology related to cancer. And it really showed an amazing change, and a host of amazing changes in the lung cancer space. And it's really, the whole report could have been the sort of the lung cancer good news report, because it really led the way with the changes that are coming with the implementation of lung cancer screening, the introductions of novel approaches to treatment in terms of immunotherapies and targeted therapies. As a nation, we showed a 4.5% reduction in late stage lung cancer diagnosis, which is incredible. The whole thing was just a packet of great news, which is not always experienced by the lung cancer community. And with greater implementation of lung cancer screening and reaching more folks with our evidence-based interventions for following diagnosis, we're going to see a continuing trajectory. And I think the charge is to make sure that's an equitable trajectory, so that all communities receive the benefits of these innovations in early detection and treatment for lung cancer. And so the lung cancer community doesn't often have many opportunities to celebrate, but we're all cheering and excited about these changes that have finally emerged after decades of unfortunate stability.
Awesome. Thank you for sharing that, Jamie.
And Jamie, I popped the whole report in the chat for anybody that's interested in seeing the whole thing.
Daniel.
So I'm with the Office of Community Outreach and Engagement at the University of Colorado Cancer Center. And the main thing that the biggest project that we're working on is really focusing on improving our numbers of underrepresented minorities in our clinical trials. So we've done a really deep dive into our data to really understand the population that we're currently serving, working really hard on changing the policies to improve access for under and uninsured population to be able to come to the Cancer Center. And we just hired a cultural and linguistics coordinator and starting to make sure that all of our materials are going to be available in Spanish. So that's our update.
Thank you, Daniel. Anybody else? Don't be shy. I know you have great work going on.
I can go, Christy, from ACS. So just a couple quick updates. Many of you are familiar with our Road to Recovery program that has volunteer drivers drive patients to their cancer treatments. And as many of you know, we discontinued that program in 2020 due to the pandemic, but we're happy to share that we are working on relaunching that program. And we are currently piloting our new app-based technology in El Paso County, which is Colorado Springs. So more to come, and hopefully we will get that program fully relaunched here soon. So that's kind of our biggest ACS update right now.
Great, thank you. All right, any other updates?
Christy, as most of you know, with launching the cancer plan down in Cheyenne Wells, how hard it can be to get a lot of the screenings done in southeastern Colorado. One of our biggest struggles down here in Lamar, which is further south than Cheyenne Wells, has been getting mammograms done down here. And here at High Plains Community Health Center, we are actually adding our own mammogram machine here in our facility. We should have it up and going by the end of February.
Awesome. All right, who's next? Okay. We will move on then. I'll put the link to the evaluation in before people hop off, but I do want to again encourage people to stay on for this networking space. You know, we don't get to do this in person anymore right now, so I've heard rave reviews when people do stick around for this. So please stick around for this networking part. We're also please be patient with us because this is the first time we're going to have a Spanish speaking room and then the other breakout rooms. So if you are listening to the Spanish interpretation, don't go into a breakout room, stay in the main room for you all to discuss there. And then if you want to go to another room, you'll have to just choose a room. And so I might, if one room ends up with a lot of people, I might kind of move people around. But when I click create, head to those breakout rooms and we'll stay in there for maybe 10 minutes and then come back and then see if people want to go back into a new room or if you want to stay in for longer. So we'll head into those for 10 minutes and then I'll bring you back in here. Let me just put one thing in the chat before I put you all into breakout rooms. Please today, make sure you take the evaluation. We want to make these meetings as useful as they can be for you. So please give feedback on how we can make these useful for you. Yeah, I just appreciate that feedback. So any questions before, I see a few people have already hopped off. Any questions before we go into the